I've never done this before, but for those of you who don't know, my name is Amy. Hi. I have borderline personality disorder. I was diagnosed at the age of 25. I have been experiencing borderline symptoms since the age, at least since elementary school, primarily depersonalization and derealization. I would feel it all the time, but you know, when you're that young, you don't really understand what's going on. So in my head, I would be like, oh my God, I have a sense of deja vu. I must be a psychic. And that went on for a really long time, thinking that I had some crazy magical powers or something. Because like, you know, at the age of 5, 6, 7, you're like, you know, you don't know about mental disorders really. You don't know that people can get sick with, you know, up here. You know, it's just that feeling that I'm experiencing reality twice, which is a very strange, unsettling, trippy feeling, you know? So I've been experiencing this my entire life. I thought that this was normal, but I knew that this was normal for me. You know, there was something inside of me, at the core of me, that knew that I experienced life in a way that other people didn't. And it made my disease, and I sometimes do refer to the disorder as a disease because I don't think people understand how sick it can make you. And I think it made my disease a little worse going through school because I just desperately wanted someone to understand what was going on, but at the same time I was so ashamed of the way I interpreted things, and I didn't feel like I belonged in this world because I knew that things were different for me. It was a very strange, floaty feeling, and as someone who is a writer, I spent ages trying to figure it out, but that's beside the point. May is Borderline Personality Disorder Awareness Month, and I thought that maybe I should do a little video once a week for the month of May and just talk about a subject. And overall, I think that I would really like to educate everybody on what recovery is like for borderline patients. You know, we talk about the downfall all the time. You know, everyone has their own definition of what rock bottom is, and you know, how rock bottom is just deeper and deeper and deeper into the pit. But I would really love to talk about the recovery period, because what is recovery? So I am in a specific kind of therapy called dialectical behavior therapy. And when people hear that, they look at me with a blank face and they're like, what? Because it sounds crazy. It sounds like a mouthful, and it is. Dialectical behavioral therapy. I can't even say it half the time. So what does it mean? Well, behavioral therapy is easy to understand. We're focusing on behaviors. And that's easy enough to understand. It's like cognitive therapy. It's, you know, like, how can we adjust your behaviors? Dialectical is the first word of the sentence of the therapy, and it's the one that throws everybody off because nobody understands like what that means, especially in terms of therapy. So, where does it come from? In the 80s, a woman named Marsha Linehan realized that regular therapy, cognitive therapy, you know, was not working for borderline patients, and it took her a minute to understand why. But she was also, oddly enough, she practiced Buddhism. And so she took a form of meditation and Buddhism that's called mindfulness, which I'm sure everybody has heard of, or most people have heard of, and she combined it with her psychiatry practices. And so she developed a kind of psychiatry practice where not only are you taking the science behind therapy, but you're also integrating not a spiritual essence, but the principles of the spiritual practice of mindfulness. Why? Now you're going to ask, why mindfulness? And why am I referring to it as a practice instead of a spirituality? I'm going to tell you right now. DBT, in my opinion, and in my own journey, because, and I hate that word journey, I'm going to eliminate that. In my own experience, is the core of DBT practice. As a borderline, we are consumed by our feelings. I just did a Trump thing. When I am in love, I'm gunning for it. I constantly have to check myself with my boyfriend. Sometimes I'm just looking at him and he's like, please stop looking at me like that. And I'm just like, sorry, my borderline was popping out. When I'm depressed, I am fully depressed. I am depression. I think truly borderlines are the personification of emotions. And because we feel like we don't have a personality, we feel a loss of sense of self, which again, in my own opinion, is the number one symptom of a borderline patient. When we feel something, we tend to cling to that as if it is our personality. So again, in my own opinion, I am not a doctor. I am just a patient. I am just a borderline. Like, what do I know? Borderlines are the personification of emotions, period. So we are consumed by it. And when we're consumed by it, we believe it, we feel it's true, we're gunning for it, we're just like, this is us, and this is right, and we can be ashamed of it, and we can feel guilty for it, but this is who I am, and that means if you invalidate my feelings, then that means you're invalidating me. And that's what leads to the depression and, feeling, and, but I mean, I'm just speaking for myself. But what mindfulness does is that it helps us create a small distance from those emotions. It helps us, and it takes a lot of practice. A lot of people, I feel like people tend to stay away from DBT. They tend to, one of the reasons why, like, they say borderlines refuse to get better, it's not a refusal to get better, it's just an incapability to grasp the fact that you can step away from your feelings. It takes all of your willpower, and willingness is the first step. It's like, you have to be able to just, like, you have to find it in you to just give yourself over and just be like, I'm gonna try this, 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 and just keep fucking trying with it. Willingness is so important. And with mindfulness, it teaches you that, my best friend told me that emotions are like the weather. Sometimes it rains, sometimes it's shit out, and sometimes it's super sunny. And she told me it at the right time in my life, and it clicked, because that's exactly what mindfulness is trying to teach you. Emotions can pass without you being consumed by it, which is mind-blowing. Like, I've never felt like that before. And while I am still in the thick of it, it helps you take a step back. And once you take that step back from your emotion, you're able to, that's just the first light bulb. That was my first light bulb, was when I finally understood what mindfulness was and what it meant to observe. So that is the first step of my recovery, was truly understanding what mindfulness was. I'm not sure what part of DBT I will be talking about next week, but thank you for listening, and I hope you guys have a really good day. Thanks.